Hi everyone, and welcome back to my channel. Today we're going to talk about under eye circles, and these are definitely the bane of my existence, and if you're watching this video, you probably want to learn how to treat them too. Now, it might be hard to see my circles because I conceal them and I have a ring light here. I actually learned how to use concealer from 16-year-olds on TikTok. Before I even tried TikTok, I didn't even know what the terms baking and highlighting and all these other makeup terms. I had no idea what they meant. So I actually learned a lot from makeup artists on TikTok. My name is Dr. Swati Kannan, and I am a board certified dermatologist out here in California. This channel is meant to educate you on the latest and greatest skincare trends and all the things that we do within the field of dermatology. And I'm also here to bust some skin myths. There's a common misconception that eyelid creams will solve all of your problems, and we're going to learn that that's not really the case. When people first look at you and when they're talking to you, they focus on the part right below the eye. So mainly on the eyelid skin and the cheek skin. And that's why eye circles are noticed immediately. Eyelid skin is also very thin and often displays the first sign of aging with fine lines, wrinkles, and discoloration. So often people will hear, "Oh, you look tired today. Did you not get enough sleep?" And boom, they are in my office looking for treatments just because eyes are really the first thing that people notice. So first, let's understand why you have eye circles. And there are a multitude of reasons for under eye circles, and one eye cream cannot possibly address all of those concerns in a little jar. So under eye circles can be due to extra pigment in the area. This is very common in ethnic skin, people like myself, Indians, Middle Easterns, and several other skin types. Often within ethnic communities, you will even see children that have darker kind of under eye area. And with age, this only darkens and widens. The extra pigment is either due to melanin, which is the pigment producing cell of the body, or due to hemosiderin, and due to hemosiderin, which is iron deposition into the eyelid skin. Now, most people think that the reason they do have eye circles is because of increased pigment, and this is actually not true. The way you know if you have increased pigment is if you pull down your skin like this. If you have increased pigment, the pigment will also be pulled down and will appear lower on your cheek than if you don't have pigment. Now, if you don't have pigment, you will notice that when you pull it down, the darkening actually decreases. The other way to know is if you take a mirror and you lay down and you put the mirror on top, if your eye circles still look the same, that means that it's due to extra pigment within the eyelid skin. And second cause is from prominent vasculature that is present in the eyelid skin. So often as we get older, not only does the eyelid skin thin down, but the blood vessels also become a little bit thicker. So they have more prominence, and that therefore you have this bluish discoloration that appears underneath the skin. And this can often look purple, blue, or brown. The way you know if you have that is when you do pull down your skin, the dark circles actually decrease. So that's how you know that bluish or discoloration is from the underlying blood vessels. Third cause is from structural changes of the bone, muscle, fat pads, the anatomical changes that occur underneath the skin. So when you look at the anatomy of this area, it is composed of the orbital bone, which is the bone that encircles the eye, certain ligaments that attach muscles onto the bone, deep and superficial fat pads that give that convexity right here to the cheekbone, and of course muscle and skin. So as we age, we know that we lose a lot of that bone. So that means that orbital bone becomes wider. And when that happens, it causes the ligaments and the fat pads to loosen and to be displaced. So that is usually characterized by these puffy eyelids where the fat is herniating below where they used to be. The other structural defect is a true tear trough, meaning that there's actually a hollowness right along the orbital bone, giving you that shadowing or making the discoloration look worse. The final cause is kind of miscellaneous. So patients who have allergies or they're just tired, they ate a lot of salt the night before, you're just going to have a little bit more puffiness, and that's because of increased water retention in the eyelid skin. All right, so how do we treat all of these different causes? So let's start with the fourth cause, the miscellaneous, which is the easiest. If you have puffiness because of allergies, then obviously taking an allergy medication like Allegra or Zyrtec would be really beneficial. This will then help reduce some of the puffiness from increased water retention. You can use eye drops, but eye drops won't really help the puffiness, but they will help with the itchiness, so you rub less. By the way, if you rub your eyes like this, which unfortunately I do because I have horrible eye allergies. If you rub your eyes like this, you're going to have friction that's then going to darken the skin. So try not to rub your skin as hard as it is. For eyelid puffiness, you can actually use a cold spoon or one of these, the jade rollers. Often people don't really use these properly, so they tend to like do this or kind of go in these random, patterns to help with the lymphatic drainage or the flow, but that's not how you use it. You want to use these cold jade rollers kind of in the direction of the lymphatic vessels. If you're going to be doing it for eyelids, you want to go from the medial aspect, which is right near your nose, and push out and then go along to the lymph node in front of your ear and down. So we have lymph nodes in front of our ears that then drain down to the cervical lymph nodes. So you really want to do this method. So from medial to lateral and down. If you do this for about 5 minutes in the morning or even less, it would probably help with your puffiness. You don't have to buy these fancy jade rollers. You can just have a cold spoon and that would be just fine. You can also use creams with caffeine in them, even just a caffeinated tea bag. Basically boil some water, put your tea bag in it. You can use green tea or black tea. I like green tea because it also contains flavonoids, which have the antioxidant properties. You let the tea bag steep for a few minutes and then put it in the fridge for about 15-20 minutes. Let it get nice and cold and then apply it to your eyelids. I feel like that takes up a lot of time. It's just easier to use an eye cream with caffeine in it, but it's cheaper. So if you tend to get puffiness because of water retention anytime you have salt or alcohol, make sure that before a big event like your wedding, that you reduce salt for 48 to 72 hours before the big event so that you have less puffiness. The other trick that people do is they take a medication called spironolactone. Spironolactone is what we use for acne, and it's also diuretic. So if you start a low dose like a month before your big event, you will be a lot less puffy on that day. For my wedding that I got ready for, I didn't take spironolactone, but I eliminated my salt intake for 3 days before the wedding, and even my overall face was less puffy. So a lot of people do tend to retain water from salt consumption. So how do we treat the third cause, structural changes causing eye circles? This one's a little bit harder just because you have to truly evaluate the patient to see why they're getting puffiness or shadowing or circles of their eyelid skin. I think everybody just jumps to using fillers in the tear trough area. Not everyone is a good candidate for tear trough filler. I actually got tear trough filler a few years ago and it gave me eyelid puffiness and increased water retention. I then had to dissolve my filler and I haven't done it since. So when we use hyaluronic acid fillers, hyaluronic acid is a sugar molecule that then attracts water. There are certain fillers that attract less water than others, but if we put filler here, we can either obstruct the lymphatic flow, causing water retention, or the filler itself causes water retention, and if it does it too much, then you're going to have more issues. Because of the propensity of the filler to attract water, I have found that patients who tend to have water retention in the area in general, these people are not good candidates for filler. So how can you tell if filler will actually help you? If you push your cheeks right here, so you just kind of push, and you notice that the hollowness, that the shadowing gets better, then you might be a good candidate for filler. But if you notice that it's not getting really that much better, then you might not be the best candidate. If you have fat displacement, meaning that the fat pads have herniated down, causing puffiness, then we can use filler to camouflage that, but filler is not really the best treatment or best long-term treatment for fat pad herniation. Usually people need surgery, and this is a type of blepharoplasty where they take the fat pads and kind of translocate them so that the puffiness is reduced and it recreates the convexity of that cheek area. Now in this patient of mine, she has several issues that are causing the eye circles. The main thing in her case is fat pad herniation, so what we just talked about. We discussed that surgery would be the best option for her long-term, but she really did not want that, and in this case I actually did use filler to help camouflage. But the reason I did this is because she has really good convexity of her cheekbones. So by adding a little bit more filler to her cheeks and then adding filler to her under eyes, I know that her cheeks will be able to support the under eye filler that I placed. So she ended up getting a pretty nice correction. But like I said, this is not a treatment that I would do on just everyone willy-nilly. Also related to the structural changes, since eyelid skin is very thin, it's often the first place where you see fine lines and wrinkles. And so that's why we can perform Botox, especially I think this works well for younger people, but we put Botox right here for the jelly roll, which helps to kind of decrease that muscle when you smile. We also put Botox for the crow's feet here, which are the lines caused by smiling. So Botox, I think, is a really great way to start decreasing the appearance of fine lines around the eyelid skin. Laser surfacing, though, is really the best option for thin eyelid skin and wrinkles in the eyelid skin. Laser resurfacing causes collagen building, which then leads to pretty drastic improvement of under eye wrinkles. Now, of course, you're like, what about eye creams? Because that's what a lot of YouTube channels talk about, is what eye creams you can use. And I'm definitely going to talk about eye creams in the second part. I feel like eye circles are such a broad topic. I could talk about this for hours. So I'm going to split this up into two parts. This part's going to focus on the interventions that actually work, and then the second part's going to focus on eye creams. I think eye creams help, and they might help maintain certain results, but they are not going to cause such dramatic results. So really, for collagen building, you want to use eye creams with retinoids. A lot of skinfluencers will say, oh, just use your facial retinoid on your eyelid skin. And I completely disagree. Since eyelid skin is thinner, you want to use skincare products with gentler active ingredients and ones that are more hydrating. So I will review this in my part 2, stay tuned. Now, if you have a bluish hue causing your eye circles, then you can definitely still try caffeine or eye creams with caffeine to help constrict those blood vessels to then make that area look less blue. Additionally, you can also try eye creams with vitamin K. Vitamin K is an ingredient that actually breaks down bruising. So I'll use it right after I do any under eye procedures. I know that's going to cause bruising. I'll ask patients to either use arnica or a vitamin K based cream to help eliminate that bruising faster. Now, any skin ethnicity can have increased veins underneath the eyes. So if you're Caucasian and you have prominent vasculature, it's going to look blue or violaceous. If you are ethnic skin and you have prominent veins, it's going to just look a little bit browner or greenish brown. And like I said, the way you know if you have under eye circles from increased pigment versus vasculature is if you pull down your under eye skin like this. If it's from vasculature, then the under eye circle is going to appear less pigmented, and that's how you know it's from blood vessels and not just from increased melanin deposition. Now, the best treatment for increased veins underneath the eyelid skin is actually laser treatment. We have 2 different kinds of laser wavelengths that we use for blood vessels, and depending on the skin type, we can use one or both of the wavelengths to help treat the veins. And I feel like it makes a really big difference. I actually got this done as well because I noticed that my veins were becoming really prominent, causing my under eye shadows to appear worse. And I felt like this laser treatment made the biggest difference for my under eye circles. I also do have increased pigment underneath the skin, so I did do other things as well for that, which I will talk about next. But laser treatments for blood vessels really is the best thing to do. If you do want to get laser treatment done for the veins under your eyes, it requires pretty significant technical finesse and education. So make sure you see a board-certified dermatologist or oculoplastic or plastic surgeon, somebody who is really comfortable with using lasers underneath the skin. For ethnically skinned patients, we tend to use a longer wavelength called 1064. That's what I had done as well. The main risk with this is burns. So that's why see somebody who knows what they're doing. And finally, for skin circles caused by increased pigment, this is the toughest to treat. As I said, I also have increased pigment in the area, and before my wedding, I really wanted to reduce these circles. And so, yes, I did the laser to treat the veins, but then I also did a gentle resurfacing laser called Clear and Brilliant, and I did a series of about 4 treatments, kind of targeting my whole face, but really under my eyes, which helped with the fine lines as well as some of the dark circles because it produced more collagen, thickening the skin, thus reducing the appearance of the melanin that's underneath the skin. You can also try creams with brightening agents like kojic acid, arbutin, vitamin C, and niacinamide, as well as just hydroquinone. So hydroquinone, as I talked about in my melasma video, is really the gold standard for lightening the skin, but you don't want to use a very high strength. Over the counter, you can get 2% hydroquinone called Ambifade, and you just want to use a very thin layer, right under your eyes for 6 to 8 weeks, and then you take a break. I think prescription strength hydroquinone is obviously better, so I generally will give about 4% hydroquinone that they can use right underneath the eyes for a period of 8 weeks. You definitely want to really be good about your sun protection, so not only using sunglasses and hats to cover that area, but especially using sunscreen in this area will help to minimize darkening of the skin over the years. Now, you can definitely have a combination of all of these causes which are contributing to your dark under eye circles. So it's important, like I said, to see a cosmetic dermatologist or specialist, especially if you want to get treatments like lasers and fillers. And in part 2, I will talk about some of the eye creams that I recommend. I always like to recommend eye creams in combination with other interventions. So stay tuned and don't forget to hit the subscribe button. Well, thank you so much for watching my video today. I hope you guys have a wonderful rest of your week. If you have any comments, questions, or even topics you want me to cover for future videos, please comment below and I will respond. And don't forget to hit the like and subscribe button. See you for part 2.